Hi and welcome to Heal My Hemorrhoids. In this video you will learn how long it takes for hemorrhoids to go away. So watch the whole video to the end to get all of the tips you need. Remember to hit the subscribe and like button if you like this video. In general, it will take about a week for regular hemorrhoids to clear up and shrink. If you take action immediately when you feel them, the healing time is in general about a week. The first thing you need to understand is that no matter what kind of hemorrhoids conditions you have, they can go away if they're not in a very serious condition. In fact, everyone has hemorrhoids conditions, it's just a matter of seriousness and symptoms. You may even have to simplify your diet plans along with having a way of life changes. There is a link in the description for an easy 5-step way of treating hemorrhoids permanently. Go and see how it can help you, or head to healmyhemorrhoids.com for the link too. How long does it take for external hemorrhoids to go away? Some external hemorrhoids become so augmented that they stick out of the anus, which is a bad sign of the severity of the condition. These are called prolapsed hemorrhoids. In general, if this is your first time having external hemorrhoids, they will go away for themselves in a day or 2 days. The more they come back, the longer it will take for the hemorrhoids to go away. In the description is a link for an easy 5-step method how to treat hemorrhoids permanently. Check it out and see how it can help you. You find it also at healmyhemorrhoids.com. Prolapsed hemorrhoids can take more time to get healed automatically if you don't use any other treatment options. And that includes both natural and aggressive treatment options. And that's why it certainly requires treatment from a specialist. The problem with women having hemorrhoids conditions is that a few of them can have hemorrhoids during pregnancy, which is a bad sign. This is on the places where it expanded to a range where it poses a severe threat in your rectum as well. And it happens specifically in the 3rd trimester, may make the veins in your rectum and cause severe swelling in your anus, and it surely causes very much discomfort. A lot of medications for pregnancy may even make it almost certain for your veins to grow, which is most certainly the worst thing for your hemorrhoids. If somehow you develop forming hemorrhoids during pregnancy, your side effects may go on until you conceive, and that's really painful for pregnant women to bear. How long does it take for thrombosed external hemorrhoids to go away? In general, the swelling and pain should start to go away after about 5 days, but it will take 2 to 3 weeks for the lump or clot to completely go away. It's pretty obvious by now that hemorrhoids conditions are swollen veins in the lower area of the rectum, and it's particularly seen in middle-aged people all over the world. Hemorrhoids can happen inside the coating of the anus or rectum, but that's not all about it. It can even shape at the inside of the anus. A thrombosed hemorrhoid happens when blood clusters become caught inside the hemorrhoid, which you should take note of. It is a typical confusion of hemorrhoids since there are different types of hemorrhoids that can be seen. The tone is because of blood coagulation inside veins and causing it to block bowel movements. Manifestations that go with a thrombosed hemorrhoid are frequently more serious than the normal hemorrhoids types. The symptoms include a lot of discomforts like very intense irritation and itchiness around the anus, severe pain both from the inside and outside, extreme swelling that keeps lasting, and so on. Why is it important to take action straight away? The main reason external thrombosed hemorrhoids have a tendency to grow because of unnatural pressures from the lower rectum. It's a slow process, and that's why it also takes a lot of time to go away as well. The main problem here is that the more time the patient stays away from dealing with it, the worse it gets. And that's how it becomes even harder to get healed and make it go away automatically. There are also other different reasons why external thrombosed hemorrhoids needed to be taken seriously so that they can heal on their own quickly. The reasons include accidental severe injuries near your anus, along with regular heavy weightlifting, pregnancy, being obese, straining your anal canal too much, or even having anal intercourses. Other reasons are having to sit at a place for login time, being constantly having diarrhea or constipation, and having a low-fiber diet. There is a link in the description of how you can treat constipation. Do external thrombosed hemorrhoids go away on their own? Many thrombosed external hemorrhoids may disappear within half a month without causing much trouble, but that's always not the case, which should be noted. Having a condition of external thrombosed hemorrhoid creates under the skin encompassing the anal canal and causes severe discomfort among patients. This is because of the presence of blood coagulation in the vein. That's the only big reason why it's more severe than typical hemorrhoids conditions. The pain of thrombosed hemorrhoids may improve within 7 to 10 days without medical procedure and may go away pretty fast, and that's the good news. What if thrombosed hemorrhoids don't go away? The bad news, however, is holding on to the symptoms and not doing anything about them. Nothing happens properly if you don't do anything about it, and that's why you need to act the part to take care of thrombosed hemorrhoids. At the very beginning of having thrombosed external hemorrhoid veins are a total mixture of pain and irritation that can only be described by someone with the condition, and that's how we can express how seriously terrible this condition is. Following a couple of days, this particular issue causes terrible signs to appear that includes hidden blood cluster on the overlying skin. It even will pretty much lead to unconstrained damage of the skin and some serious issues of the anal canal as well. What shrinks hemorrhoids fast? The presence of this blood can be disturbing yet somehow natural with this condition. This condition, however, is directly and is additionally connected with a reduction in the blood clots that come with it. But the positive news is that it can also lead to an overall improvement in the most disturbing side effects, so it is not to be taken lightly. Now about the matter in hand of having the hidden blood clump. It doesn't exactly help with the bowel movements, which is the main point of the discomforts it causes, and all of that during the initial few days. It's at that point the body will be in the long run to reabsorb the thickened blood inside in a couple of days, and it can finally go away. But there still are some pressing matters to discuss, since the blood coagulation may almost certainly be reabsorbed into the body in a couple of days or in about 2 or 3 weeks. And between these days, a lot of inconveniences may happen if the clots aren't completely reabsorbed, and that's the bad news. If by any chance that it stays in that condition, it is highly recommended that you seek aggressive treatment methods, since it will probably keep getting worse, and that's definitely not what you want to have. How long does it take for internal hemorrhoids to go away? In general, internal hemorrhoids will disappear in 7 days with home remedies. The internal hemorrhoidal conditions pretty much emerge from the hemorrhoidal veins that lie under the mucosa of the lower rectum and at the end of the anal canal. Strainings are the main enemy, and they can surely trigger your hemorrhoids no matter what the types are. Internal hemorrhoids are certainly a confusing condition, and it makes the patient even more stressed. These hemorrhoids are situated over the pectinate line and are covered with cells that are equivalent to those that line the remainder of the digestion tracts. It may sound all fancy, but the basic concept of internal hemorrhoids is pretty simple. Compared to external hemorrhoids, which emerge beneath the line and are covered with cells that take after skin, internal hemorrhoids are pretty much completely a different kind of condition. Internal hemorrhoids take less time to go away compared to external ones, and it takes pretty much 1 to 2 weeks if you consider positive lifestyle changes. How long does it take for thrombosed internal hemorrhoids to go away? In general, the discomfort of the lump from the internal hemorrhoids will go away in 10 days or less. The clot or lump usually takes longer to go away. Usually in a couple of weeks it will be gone. The typical thrombosed internal hemorrhoidal tissue can't be seen, since it should initially grow and get agitated or build up coagulation to cause it to grow even severely. That's why there are different labels to describe hemorrhoids, which is a pretty obvious reason to tell them apart. It's certainly visible, and anyone can see swollen external hemorrhoids or inward prolapsed hemorrhoids uncovered on the anus. But that's not the same case with internal thrombosed hemorrhoids. The internal thrombosed hemorrhoids are even more serious and can't be seen on the grounds that they stay inside the rectum. Are internal thrombosed hemorrhoids permanent? And now we come about thrombosed hemorrhoid, where it will show up as an irregularity at the anus area, distending from the anal canal, and will be dull pale blue in shading as a result of the blood coagulation contained inside the swollen vein. It looks pretty terrible, just like the symptoms it comes with. Although non-thrombosed hemorrhoids will show up as a rubbery bump, unlike the one we just described. Frequently more than one swollen hemorrhoid shows up simultaneously, and there's a bigger note on that. But it's kind of the same as the non-thrombosed internal hemorrhoids. If you wait until it gets to the point of no automatic healing, it'll get even more serious. If not, it'll go away within weeks. What to do if your condition doesn't go away? You'll need to contact your personal physician about your condition. Your personal physician will get some information about your side effects and clinical history so that he can build up a solid strategy on your treatment procedures considering the type of hemorrhoid you have. During the test, they may embed a gloved, greased-up finger into your rectum to feel for any protuberances or developments, and it is certainly necessary. This is known as a digital rectal test, and it's important for figuring out the next steps. If there's any chance that you have signs or are in danger of colon cancer, you may require one of these tests to peer further inside your colon. Sigmoidoscopy. The specialist will proceed to use a flexible tube-like camera inside your rectum toward one side to see the base of your colon to get an accurate result. The scope, however, lets your physician search for different harmful developments called polyps, and different changes in your colon along with other possibilities that might be necessary for the test. In a colonoscopy, the specialist uses different tools to take a look at the whole length of your colon and get an accurate result on your issues. How could it be dealt with? The very basic treatment for a thrombosed hemorrhoid depends on a lot of things that you need to consider. It's called external thrombectomy, which makes a little cut in the coagulation and channels it to make the report more accurate. You will get local sedation to keep you from feeling pain and other discomforts. This system works best in the event that you have it inside 3 days after hemorrhoid shows up. It works rapidly, yet the coagulations can return. The best way to make your hemorrhoids go away easily is to be aware of your condition first. Take it seriously if you don't want it to end up being something you wouldn't even imagine. That's why you need medical advice and proper awareness of the problem so that you can take care of it without taking up aggressive treatment methods. Thanks for watching. Don't forget to hit the like button and subscribe for more videos. I hope the video was helpful for you. For more articles and videos, go to healmyhemorrhoids.com or this YouTube channel.